Ambulation or walking is one of the most important functional activities we do and something we frequently work to improve in physical therapy. In this video, we will examine the motion that occurs in the transverse plane during a normal gait pattern. Before specifically looking at the gait pattern, let's review open and closed chain motion in the lower extremity. Open chain motion means our distal extremity is free to move. Moving that distal extremity inward towards the midline is medial rotation, while rotating that extremity outward away from the midline would be considered lateral rotation. In a closed chain, the distal end of the extremity is fixed, so we're more interested on relative motion of the pelvis on top of the femur. If the left side of our pelvis protracts or moves forward, it equates with internal rotation at the right hip. If the left side of our pelvis retracts, it equates with external rotation at the right hip. Understanding this closed chain relationship is very important to understanding the rotational movements that happen at the hip during the gait cycle. So let's follow our left hip through the gait cycle. At initial contact, the right side of our pelvis is retracted, putting our left hip in slight lateral rotation. At mid-stance on the left, our hip is in medial rotation as the right side of the pelvis has now started to move forward. As the left lower extremity reaches the end of stance phase, the hip is moved back into a slight laterally rotated position. It maintains this lateral rotation throughout swing as the pelvis advances forward. So our hip is slightly laterally rotated at initial contact, moves into medial rotation during stance, and then back to lateral rotation for the swing phase. Now let's take a look at the pelvis. In the transverse plane, the pelvis rotates around the L5-S1 junction. So let's follow our right leg. As the right lower extremity swings forward, the right side of the pelvis is in a protracted position. As we transition and the right leg moves from front of the body to the posterior part of the body, the right side of the pelvis retracts and then returns to a protracted position during the swing phase. So let's follow the left side of the pelvis. At initial contact, the pelvis is protracted. As that lower extremity transitions posteriorly, you can see that the left side of the pelvis moves into a retracted position. It then returns to a protracted position as the leg swings forward to get ready for initial contact again. Because our pelvis is one solid bone and rotates around the L5-S1 junction, when one side of our pelvis is retracted, the opposite side will be protracted. So let's compare both sides of the pelvis during the gait cycle. So as the left side of the pelvis is protracted, the right side will be retracted. The pelvis then passes through neutral as it reverses position. Here we can see the left pelvis is protracted while the right one is retracted. As we advance through the gait pattern, you can see the pelvis adopts an opposite position, where the left side of our pelvis is retracted and the right side is now protracted. So the pelvis begins in full protraction at initial contact, moves to full retraction during stance, and returns to full protraction at the end of swing. The other area of transverse motion we're interested in occurs in the trunk. While the pelvis moves through its cycle of protraction and retraction, the upper trunk is moving in the opposite direction. This can be seen by the relative position of the shoulders to the hips. So as the pelvis moves one way, the shoulder moves in the opposite direction. This provides a counter-rotation that occurs between the upper and lower part of our trunk. This counter-rotation can be observed more easily from above. Here you can see as one side of the pelvis is moving forward, the shoulders are rotating backwards. So in observing gait for trunk motion, be sure to keep an eye on the position of the shoulder relative to the pelvis. The upper extremity and lower extremity should be moving in opposite directions. Here we can see our shoulder is positioned forward while our pelvis is positioned posteriorly. At the other end of the gait cycle, our pelvis is now transitioned in front of our shoulder line. So let's review transverse motion at the hip, pelvis, and trunk. The hip is in slight lateral rotation at initial contact. As we transition through stance, the hip moves into a position of relative internal rotation and then returns to a slightly laterally rotated position during swing. The pelvis moves from protraction at the beginning of stance to retraction at the end of stance and returns to a protracted position during swing. The upper and lower parts of our trunk move in the opposite direction. This can be seen by the direction the extremities are traveling at different points in the gait cycle. So as the pelvis is in a protracted position, the shoulder girdle is in a retracted position. As the shoulders move forward, the pelvis moves backward. Understanding transverse motion is an important part of effectively treating gait.